Sounds good.
All right. Well, I think we'll start going now, and we'll go over the 3 products that we had mentioned in our email. So our big goal today is to go over our Seymour model, our Wilma wound foot, and then our Ostomy pouching trainer. After we go over all 3 of those, if there are other wound care products of ours that you have seen or you're interested in finding out a little bit more, we have almost all of them in the room here with us, and we'll be happy to pull those out and show you or answer any questions related to those. During the demo of the first 3 products, if you have questions that come up, feel free to either unmute and ask, or you can type it in as a chat and let us know, and we'll see those, and we'll be happy to answer any of those as we go along. And then again, this will be available afterwards for anybody that wants to watch it as well. So thanks for joining us. We're kind of excited to do this. It's our first time doing a product demo online like this, and I think with a lot of the normal trade shows and conventions that we attend, and we're able to get in front of people and show them our products in person, we definitely were missing that this year. So this is kind of a way for us to be able to have that interaction with people and hopefully get some information across to you, answer some questions, and hopefully have a good time doing this. So we'll start out here with our Seymour model. And I guess one of the things that we always like to say about Seymour is this is kind of, if you've seen any of our products before, this is the one you've most likely seen. Seymour has been around in one way or another for almost 20 years now, and it is a great model because it's going to show you all the different stages of pressure injuries. It's going to allow you to visually see them, to measure them, to understand why you stage them in a certain way, and then also going through charting, measurement, the application of various dressings from a simple topical bandage, creams, to negative pressure as well. And you can do all those on this model. The dressings are going to stick, but they're also going to remove, and it should last for years and years and years. So basically, when you look at Seymour, the first thing you're going to have is you're going to have on this side here your stage 1. On the other side, you have your stage 2 pressure injury. And then as we move to the side here, you're going to have your stage 3. I'm going to kind of try to show you down there, we have a small tunnel. And then on this side of the stage 3, you're going to have a little bit of undermining that goes up there as well. Above that one, you're going to have a unstageable, and that's going to have the wound bed's going to be covered with the slough you can see there, as well as the S-scar on the side. When we flip to the other side of the model, you're going to have your deep tissue injury or suspected DTI here, and then above that, a dehisced wound, surgical dehisced wound. On the top of the model, on the coccyx there, you're going to have a stage 4. You can see the exposed bone. You have a little bit of slough and S-scar up in the side here. At the top of the wound, there is undermining like there was on the stage 3. This is going to be a little bit deeper. And then down on the bottom, you're going to have your tunneling. And on this, what's nice is you can actually see how deep that tunneling is. It's rather deep. One of the things that people really like about that is that some people want to just do a visual evaluation of the wound, and they don't want to actually get in there and see how deep stuff is. And if it's a real patient, you're going to have to see how deep it really is, both to make sure that you're getting your dressing, your gauze, your foam, whatever you're using down into there, as well as being able to properly chart that. If you don't know how deep it is, you don't have any idea if the wound's getting better or getting worse over time. So that's going to be really important. The Seymour does come in light and dark skin. That's a big one. Just whatever patient population that you have, you can get the model that's more appropriate. Any of these main wounds, like I mentioned in the beginning, you can use negative pressure wound therapy on. We haven't found any dressings yet that don't work well on the model. The biggest thing we always remind people is when you're done doing a demo or done doing a training session with students, to just remove the dressings if dressings are left on for an extended period of time, over a weekend, over a week or longer. Then it is going to become harder to remove the dressings, and you're going to find that the next time you do put a dressing on, it might stick just a little bit more aggressive. One of the things we do hear from people from time to time is that their model doesn't look exactly like this. There are a lot of our first version of Seymour that are still out there, and if you have one of those, it's going to have a much smaller stage 4 here. It's going to be a little kind of triangle, almost like that, and it's going to be much more shallow. If you do have that model, there are some of those that are still working great. We did change the material on this model here because this material allows dressings to come off much easier. The previous material, we found some of the newer dressings, that the dressings were just sticking a little bit too aggressive. So again, this model here, great model. First off, people can learn how to stage wounds, how to measure wounds, how to understand what's causing them and how the wounds are going to progress. They can also learn how to measure and then chart, as well as the actual application of dressings. Now we'll take a look at our next model. And this is going to be our Wilma wound foot. And I do have it up here in both light and dark skin. Going to be the exact same as far as the wounds that are present on each model. The difference is going to be the color, the way that some of the wounds are going to present. Obviously, the deep tissue injury here on the top of the foot is going to be much more purple on the lighter skin, and on the darker skin over here, it's going to look much more similar to the stage 1. So as we go through this one here, again, you're going to have all your stages from stage 1 through stage 4, as well as about 14 other different conditions on here. I'm going to try to hit them all quickly, but if I do miss any, or if any of them are ones you want to look up, if you go to our website and search for the Wilma, you'll also find the legend on there. Randy's going to show you that legend right now. You'll see a PDF, you can download it and look at it, and it's going to show you all of the different wounds that are on there. And that's something that both comes with the model, and if you happen to lose it, you can always download another one. So as we start to look at here, you start with your stage 1. This is going to be on the ankle, on the inside. Then we go to a stage 2 on the outside of the foot here. We have a stage 3. This is a pretty large stage 3 on the heel. It's got a little bit of slough on the top of the wound, on the perimeter there. On the lateral malleolus here, we have our stage 4 with a little bit of exposed bone and tendon. And then as we work our way around the foot, we're going to have some eschar on the outside of the foot here. There's a necrotic toe. I'm actually going to come up closer to the screen because I want you guys to be able to see this. Right here in between the toe, you've got some maceration in between the two toes there. There's some small kissing ulcers right there on both of those toes. On the tip of the third toe here, we've got a callus. And then there is a corn on top of the foot there. The second digit there is amputated. And then on the big toe, we have a fungally thickened toenail. And then you also have a blister on the top there. On the bottom of the foot, you've got a full thickness neuropathic ulcer. You've got another callus right here. On the top of the foot, like I mentioned before, you're going to have your deep tissue injury or suspected deep tissue injury. And what's nice about this is that when you actually push down, it has a softer or boggier feel compared to the tissue around it, which is going to give people that secondary way to identify what it might be. And then on the top of the foot here, or closer to the calf, you're going to have a stapled incision. Just like we were talking about with the Seymour. What's great about this one here is that it gives you a way to see more wounds, to see them on a foot, identify those places where they can occur, what's causing them, how you can treat them. So if I'm learning, somebody can ask me what my course of care would be, how I would go about treating that, and then you can actually go about practicing that again, whether it's a cream, a gel, or a dressing all the way up to negative pressure. When you are doing dressings or education, it has a heel stand, so you can either put the heel like this to be able to put anything onto the toes or onto this portion of the top of the foot. And then if you are wanting to do a dressing on like the heel, you can flip it over like this, and it gives you the ability to try to get a dressing to go on the heel. This can be especially nice with a heel dressing because those are more difficult, the way that the heel drops off, and you're going to either have to use a specific dressing that is designed for the heel or make a dressing intended for a flat surface, wrap around those contours really well. Again, it comes in the light and the dark skin. Like I said on this one, you have the deep tissue injury on the top there, and this one here again, it's going to be that soft, boggy feel, but this is going to look very similar to the, right over here, to the stage 1 on the outside of the, or inside of the foot there. So again, that's going to be something where people are going to have to see something that looks the exact same, try to understand why you're going to stage it as stage 1, deep tissue injury, and deep stage 2, and then try to use multiple bits of information to actually stage it correctly. All right. The third main product that we really wanted to go over today is our Ostomy pouching trainer, and I'll wear the dark just for the stuff to know. This is a newer product for us. We've actually had it out for a couple of years, but one of the things is we didn't promote it really well because we were working on getting the production nailed down. And now that we've done that, we have started to promote it a lot more and see more interest in it. So what this one is for, this is for anyone that needs to learn more about ostomies, both what they are, how they work, and then how to treat them. More importantly, the pouching of them. So when we did this belt here, what we did is we really intended it to be used 3 different ways. First way would be is I can put it onto a mannequin or a standardized patient, and I can practice it that way there. I can put it on myself and to try to either understand what it's like to have an ostomy myself or what a patient's going to be going through post-op and try to do a pouch change on myself, or I could put it on myself and Brandy as a classmate, she could practice it on me like I'm the patient, starting to understand what it would be like, or a family member could try as well. Again, if I'm going in for surgery, I could wear this, and if Brandy was in my family, she would be able to come and practice it if she's going to have to be helping me once we get back home after we leave the hospital. So when you're wearing it, you have the ability to put stomas in 4 different locations. So on the front here, you can see this location here is slightly recessed. It's got a fold in the skin here and up here as well. And then at the top of the wound here, it has some mucocutaneous separation. So that's going to give a little bit more of a variation in how do you get a pouch to seal correctly on there, given the fact that there is those rolls in the skin. This one here, this is a candidiasis on this side here, so you have some irritation, and it actually has some texture in it, so it's not flat skin. So again, what do you do when you see that? What do you put on, and how are you going to make sure that you treat that irritation that's going on while being able to have a pouch on correctly? On this side over here, you have some contact dermatitis all the way around, so you've got that ring basically from the irritation caused by the previous pouches that were on there. And over here we have kind of that ideal, perfect scenario where you have flat, even skin with no irritation and nothing going on there. So kind of the skin everybody wishes that they had in order to put their pouch on. After you understand the 4 different places that you can put a stoma, then we have 4 different stomas that you can use. And you can use each of these stomas really at each of the spots. The first one here is going to be our more low profile or flush stoma. So this one here is going to be low profile when you put it into most of the locations. And if you put it into this location here, since it's slightly recessed, it's almost going to be flush with the skin, which again is going to have its own set of problems and issues that people have to learn. How do you deal with that, and how do you make sure you get a good seal? Next, we're going to have our loop with rod. So this one again is going to have our 2 different openings. We have our main opening right up there on the stoma, and then we have a secondary opening over there, what appears to be an opening, but nothing will come out of that one. Next, we're going to have a more proud, kind of healthy stoma. This is going to be more of the easy stoma to use, so it's going to be really, there's going to be a lot of stoma above the skin surface, much more easy to get that pouch to go around it all the way. It's fairly round in shape, so it's going to be kind of, again, ideal. And then the last stoma we have for now is going to be the urostomy. So small, has 2 stents in it, and this one can be used in all of them. Again, if you do use it in this one here, there is going to be a little bit of a gap between the edge of the stoma and the edge of that recessed area. With each of these stomas, you can put them in the model, and you can either use them dry or wet. What that means is that on the 3 main stomas that we have here, all of these here, you can have stool come out of them. And on the urostomy, you can get urine to come out of the 2 stents. So when you get the model, it will come with a pint of urine that's going to come as a concentrate. So there's just going to be a little bit of it at the bottom. What you basically do is you just fill the rest of it up with distilled water, and that's going to be your urine to use in the model. And then you will also get 5 of these small little 2-ounce bottles, and they're going to have a powder in there. You can kind of see on the back. What you want to do with that is just mix water in there. So this is some that I mixed up a little bit ago. Filled it up almost to the top and then shake it really well and let it sit for 10, maybe 15 minutes. The more water you put in, the more runny it's going to be, and you could put water up halfway, shake it up, and you're going to get a more solid stool that's going to come out. And then what you would do is you're just going to fill up syringes that it comes with. So it comes with 2 different syringes. You can fill one with urine and you can fill one with stool so that they're ready to go when you're going to be doing your class, your education, your demo, whatever it is that you're going to be using the model. So we'll go through here and show you quickly how you would kind of put this on, put a stoma in, and then actually get the stool to come out. So to get the model on, basically it just comes with this Velcro belt. You would wrap the belt around your waist, slide the back end through, and then we'll just pull it down and tighten it down. Now I don't have it on super tight because I'm going to be putting the stoma on after I have the belt on. It does also come with a second belt. That can be used for 2 different reasons. One is if you get this belt dirty, you lose it, you break it. Second thing can be is if you need the belt to go around a larger mannequin or a larger person, then you can use it as an extension, and it's going to make the belt really just fit on any size. So now Brandy's giving me this one here. So this is our more proud one. And we'll go ahead and we'll put this in. So what I do is I just pull it through the opening and then pull it tight. Go from the front and just push it in. You should hear a little snap. And now the stoma is in. And now I have my tubing coming from the outside here that I can attach my syringe to. Again, you can use it dry and just be able to practice pouching here. Now again, at this location, you're going to have to put something in here, some kind of a paste, a wax, whatever you're using at your facility. Put that in there again to get these to be flat surfaces around the stoma. None of those materials are going to cause any damage to the belt itself. They're all safe to use, as well as all of the stoma rings that are out there. So then once it's on, if I'm the one doing this, either I can hook up the syringe myself or I can have somebody else do it. For this one here, we'll have Brandy do it. And now that she's hooked up, now that she's hooked it up, she's actually going to start to apply pressure. You can see the stool going through the tubing there. So she'll keep pushing it, and in just a second, we'll see it come out the end, and you can see it coming out there. So it's kind of, it'll come out, and once you have it coming out, now you're primed and you're ready to go. You can control the flow, so you can either have it come out in one big spurt, you can pulse it where it'll come out little bits at a time. You have the ability to really control that. One of the things I think that we all know is stomas don't take a break because you're changing your pouch. So whatever management system or whatever techniques you're going to use in order to be able to get this clean, then do the work you need to do to get a new pouch on. If something decides to come out and get more stool, this is really going to give people a more real life experience, knowing that they are going to have to move quickly, but they're also going to have to keep everything clean, and what techniques can they use in order to do that. So that's pretty good. And I'll actually come up here and I want to give you guys a little bit of a close-up view, just because it can be harder to see from back there. So let's see if I can not get it right in your face, but you can see it's pretty realistic looking. And so that's one of the things we want people to understand. That's what it's going to look like, and that's what it's going to be like in real life, and that's what they should expect. So again, wipe it off, it's clean. This isn't toxic by any means. It's actually made out of all food-grade materials, so it's very safe to have.
There's no odor with either one.
Oh, yeah, it's a very good point. Yeah, there's no odor, although we have had people ask us about that. Yeah. Once you're done, what you want to do is just take your finger on the inside. I'm just going to push. You'll see the stoma pop out. And then I'll just pull it all the way through, pull it out. You are going to want to take the syringe you were using and you're going to want to flush hot water through here. If you do that, it's going to take a few seconds and the model will actually be clean. Once it dries in there, you will be able to get it out, but it's going to be much more difficult. We'll also show you really quick the urostomy with the stents. I'll put that on this side over here. You can pull it through. Once you have it in there, give it a little push, you'll hear it snap into place. And then again, Brandy can hook up the syringe with the urine in it. Ready. And you can see.
Can you see that?
No, you cannot.
Here, we'll come closer.
Yeah, there you go. You can see the urine coming out. The color is off just a little bit there, but yeah, you can see it. And again, Brandy's controlling that flow, so she can have it come out as a quick spurt or basically just little drips here and there. So again, whatever you're trying to convey in your teaching, whatever you're trying to teach with your students or with your patients, you're going to be able to do. So again, great way for people to be able to practice. I've heard from countless nurses that a lot of times patients get out of surgery and they really don't fully understand what happened. And I think a lot of it has to go with what information they're given pre-op and what they really grasp. So many people, if they're getting a stoma, they're going through a lot in their life and they could very easily tone certain things out and just kind of say, yeah, I understand what you're doing. And they don't understand maybe that this is going to really be on the outside. So it gives them the ability to see something, be able to understand it visually, which can be really important for anyone. Personally, I'm a visual person, but also we hear a lot that anybody that English isn't their first language, or there's a language barrier, this can be a huge help because they might not understand everything and sometimes they're embarrassed to say that they don't understand. So this is a great way to be able to visually show people a different way, let them see, and then they can start asking questions. I can't tell you how many nurses I've talked to where they say, oh, they think the stents, they don't understand what the stents are, how far they go in, how long they're gonna stay in. They think that the material on the outside of their body is something made out of silicone or some other kind of a plastic material. They maybe don't fully understand that it's actually part of their intestines. All those little things can be part of that dialogue where they can actually start to see those different things, understand maybe a little bit better. And again, whether that's the patient, patient's family, or staff at a hospital. And this could even be staff that's not directly involved with patient care. It could even be used for people that are just going to be working in an area where they might see this. You can do a 15-minute class and just say, hey, you might see these stomas, and here's a little bit of information about them so that when you see them, you better understand what they are, and maybe you're not taken aback by it. So again, this one comes in the light and the dark skin, comes with the 4 stomas, comes with the urine, and then it also comes with the 5 bottles of stool. We do recommend that after you use the stool that you discard it within 24 hours. That's why we did small bottles. And that's basically because if you don't, the stool will actually build up a little bit of pressure in the bottle and it can make a mess. So we just ask that you dispose of it and then use the next bottle of stool for your next one. 1 bottle of stool should be enough or more than enough material for 1 class. And then we do sell additional stool and urine separately as you go through that as it's a disposable item. Trying to think what else on that one. Yeah, so I think that's about it on those 3 models. If anyone has any questions on them or questions about any of our other models, we'd be more than happy to go over any of that right now. And again, we do have most of our other wound care models here with us today.
Hi, Stephanie.
So I did have a couple of questions. For that, first of all, I love that you have both dark and light skin, especially now with the waking up that our nation's doing. That's fantastic. Can you quote me a general price for the foot? I'd like to suggest that to my team.
Yes, the foot is, I believe the foot is $498. Let me double check that for you though, because we actually redid our pricing, and after we redid it, my off the top of my head knowledge of the pricing kind of went away.
Or you could email me if you'd like,
Yeah.
because
It is 520. I apologize.
okay. Thank you. That's
I
helpful.
will mention is if Randy, can you send a message to all of them with your email address?
Yeah.
Randy will send a quick message to you guys, and when she does that, she'll just have her email address, and if you email her your contact info, she can send you guys out a discount code to use afterwards,
Okay.
which would be a 10% off. So
Wonderful.
a nice little bonus, get your $52 off the model there.
Okay, thank you.
Yeah.
We didn't see the chat during the.
Oh, yeah. Does anyone else have any other questions or thoughts on anything?
Well, if you do, you've got our contact info, and just feel free to email anytime. I'll be happy to answer questions, and I can get you a quote if you like, Stephanie. But we appreciate you joining us.
And Paulo, I know we saw you join right at the last minute, so we are actually recording this. And again, if you want to send us your info, we'd be happy to send you a link to the recording, and you would be able to see the demo of the 3 products we went over today. And then if you had any questions after watching that, we'd be happy to answer those for you. All right, well, I think with that, I think we'd just like to thank you guys for joining us. For those of you that are watching this on the recording, we're sorry you couldn't make it for it today during the normal time. But again, if you have any questions as well, please just let us know, and we would be happy to follow up with a separate one-on-one call with you. If you have questions about a specific product, we're happy to do that, or be happy to just send you any relevant product information. Well, thank you guys. I think we'll sign off here in just a second then. And again, thanks for joining us. And we hope you and your families are all doing well through this unusual time. And we hope to see you again at a show in person sometime in the near future. All right.
Take care.
Bye-bye.